Let's sort through what we know about coronavirus. First, while many are comparing this novel coronavirus to the flu or influenza, they're actually two completely different families of viruses. This strain, the novel coronavirus that causes the COVID-19 illness, is one of many coronaviruses that are circulating in the world today. One is the virus that causes the common cold. Other coronaviruses cause more severe diseases, like MERS and SARS. This novel coronavirus is a recently discovered strain that, as far as we know, had never been detected in humans before. But because of its rampant spread across the world, on March 11th, the World Health Organization categorized COVID-19 as a global pandemic. Social distancing and self-quarantine are both strategies to help slow the spread of COVID-19. But what is the difference between them? Social distancing is avoiding close contact with other people or objects to try and reduce your potential exposure to the virus. Experts suggest a distance of 6 feet between you and others. The good thing is, you can practice social distancing and still get outside, like going on a walk, as long as you remain a safe distance from others and try to avoid touching surfaces that everyone else is touching. Self-quarantine, on the other hand, means avoiding any contact with people or objects in the outside world. Usually, this is achieved by remaining in your home, and it's usually reserved for those with suspected or confirmed infections. Since this COVID-19 strain is new, that's why they call it a novel coronavirus, researchers are constantly learning new things. The most common symptoms of an infection are fever, a dry cough, and shortness of breath. Some of these symptoms are very similar to the common cold, the seasonal flu, and seasonal allergies, but others, like a runny nose or sneezing, are not. COVID-19 can survive for a while outside your body, floating in the air, sitting on a surface. The latest research shows active virus can live in tiny airborne droplets for up to 3 hours, up to 24 hours on things like cardboard, and 2 to 3 days on harder surfaces like plastic or stainless steel. There are lots of variables to this. Things like temperature, humidity, even sunlight can play a role in how long the virus can survive on the outside. There is no vaccine yet for COVID-19. Initial trials have just begun, but it may take a year to 18 months before one is available. In the meantime, one of the best defenses is nothing new. Wash your hands. Scrub them with soap and water front and back for 20 seconds. And it doesn't matter how hot the water is. Hand sanitizer with a minimum 60% alcohol is your second best option after washing. And don't forget to cover your coughs and sneezes. Use a tissue or cough into your bent elbow, not your hand. And avoid touching your face. The virus gets into your body through your eyes, nose, or mouth. The mantra you hear from public health experts is that we must flatten the curve to protect those most vulnerable and not overwhelm our hospitals. But what does flatten the curve actually mean? This dotted line is the capacity of our health system. Hospital beds, healthcare workers, and respirators are a finite resource. If we don't change our behavior, we'll get this large, steep spike in cases all at once, and they could overwhelm our healthcare system. But by washing our hands, practicing social distancing, and, when needed, self-quarantining, we can help flatten and lengthen that curve. So what do you do if you're feeling sick? If you think you've been exposed to COVID-19 and have symptoms, call your doctor for advice first and check with your local health department. The CDC also recommends you stay at home and try to limit your interactions with others. If you have trouble breathing, of course, seek emergency medical care immediately. For the PBS NewsHour, I'm William Brangham.